Hey y'all, Dr. Aaron Miller, physical therapist here. This week's exercise is called the bent knee fallout. And what it works on is control of your lumbar spine if it's moving too much. This can result in a lot of low back pain, hypermobility. It can also lead to potential irritation at the annular or disc tissue, and it can cause nerve irritation. So, and secondary SI joint dysfunction. So what I'm teaching you today is how to do this at home, where you can properly control your spine while moving distal or another body part. So all you need for this is a stick, and you can use your bed or a table. So what you want to do, I'll describe it first, is you want to do a two maneuver thing to contract your core. And one is pushing your back flat like a posterior pelvic tilt. So you want to take your back and flatten it out just a little bit, not enough to lift your head up. And then secondly, you want to suck your belly button in like someone's poking you. So those two things, when you contract that, that's your core. A lot of times, this is what I tell people: if you can't do this by the end of today, then no sense in coming back, because this is an important aspect to learn how to do laying down, sitting, standing, running, walking, and more dynamic movements. But if you're able to do that, then you're able to control your spine so that if you have a segment that moves too much, you can control that to create less irritation. So the exercise itself, you're going to be in a hook lying position, or knees bent back flat. You put the stick right across your belt or your belly button, and what you're looking for, I like to double the pillow for myself and patients, just for comfort. So you do that maneuver where you draw in and you push the back down a little bit. I should be able to breathe, talk, and still be able to hold this. Now, a lot of people get that confused with a diaphragm because they hold their breath to kind of engage their core. Well, it's lower than that. It's belly button and doing that little tilt into the table. So in this position, what you do is I care about the abdominal draw in, and you let the leg come out. Now, if that stick moves or wobbles, you stop it and bring it back in. So you just go slow, control, out and in, and you should still be able to breathe. And you can alternate sides. Just like that. Usually I'll do about 5 to 10 on each side, trying to get them to disassociate their hip from their pelvis. And there's advanced versions of this that we'll go through in the future, but for now, that is your core exercise. Hope you like it. Thanks, guys.